The Newsday continues here on One News Now. I'm Charles Lejano. Majority of Filipinos still comply with basic COVID-19 health protocols according to the SWS. But compliance has dropped in the Visayas and Mindanao. The survey conducted from April 28 to May 2 found that most Filipinos always use their face masks outside their homes and wash their hands. Majority of Filipinos still observe physical distancing and use face shields in public transport or outdoor establishments. 75% of all Filipinos use face masks all the time when going out of the house, hardly changing from September of last year when 79% said that they always wore face masks. 67% of Filipinos, meanwhile, say they always wash their hands several times a day. 58% of Filipinos always observe social distancing in public, while 53% said they always used face shields when riding in public transportation or going to public establishments. But as mentioned, the SWS noted that compliance with these health protocols dropped in the Visayas and Mindanao. 80% of Filipinos from areas in Luzon outside Metro Manila use face masks, followed by Metro Manila with 78%, the Visayas with 72%, and Mindanao with 62%. Those who always wash their hands are now highest in Metro Manila at 76%, followed by Balance Luzon at 71%, the Visayas at 69%, and Mindanao at 52%. Those who always maintain physical distance are now highest in Balance Luzon at 66%, followed by Metro Manila and the Visayas. Meanwhile, less than half of Filipinos in Mindanao observe social distancing at only 42%. Meanwhile, just 35% of Filipinos in the Visayas still use face shields outside their homes, and only 43% do so in Mindanao. Over 60% of residents in Luzon continued wearing face shields in public for the first quarter. Experts remind Filipinos in a series of instructional videos that COVID-19 can be managed at home and does not necessarily require treatment at the hospital. Mobile journalist Jacob Lazaro gives us a front seat to the story.
It's been more than a year since COVID-19 swept through the world, ravaging communities, sending shockwaves through health systems, and sending economies into a tailspin. What people forget is that most cases of COVID are mild, easily identifiable, and possible to treat. In a series of feature videos privately produced by Batch 2003 of the UP College of Medicine, doctors explain in layman's terms what to watch out for when it comes to mild cases of COVID.
Kamusta ka, tol? Ano ka mo? Nakakaranas ka ng lagnat? Ubo? Masakit na lalamunan? Masakit na kasukasuan? Pagtatae? Sipon? Sakit ng ulo? Kawalan ng panlasa o pangamoy? Pangmumulan ng mata? Pagpapantal? Aba, mga sintomas yan ng mild COVID.
The videos also show how mild cases of COVID can be treated at home with the right home setup and the right attitude. Not everyone needs to rush to hospitals, overwhelming the healthcare system. As with any disease, isolation and monitoring is key.
Humiwalay ka muna sa mga kasama mo sa bahay. Solo ka muna sa kwarto. Sana may sarili kang banyo. Solo ka din muna sa pagkain. Magsuot ng face mask kahit pa nasa loob ka lang ng bahay. Mag-Korean novela, magpahinga. Bawal muna magpagod, ha? Deep breathing exercise. Uminom ng maraming tubig. Uminom ng paracetamol o ibuprofen para sa lagnat. Kumain ng masusustansyang pagkain.
But a word of warning too. Mild cases can worsen and become critical, thus the need for constant monitoring of the patient.
Kapag tipong hinihingal ka o nahihirapan ng huminga, masakit ang dibdib mo, wala ka ng ganang kumain, lumalala ang ubo mo, hindi bumababa ang lagnat, at nawawala ka na sa sarili mo, nako, eto na ang tamang panahon para pumunta sa ospital.
These are signs that home isolation is not enough and a trip to the hospital is needed. 93% of COVID cases recover and less than 2% accounts for deaths. But prevention is always better than cure. Aside from wearing face masks and face shields and observing social distancing, getting vaccinated is the best protection we can get.
Papa, ano po bang brand ng bakuna ang pipiliin ko? Ano ba yung the best?
Yang nasa braso mo na. Sa pagpapabakuna, mapuproteksyonan din ang mga taong hindi pwedeng bakunahan tulad ng mga bata.
The video series is privately funded by doctors of the State Medical School who saw the need to beef up the government's information drive against COVID-19. Because in the end, that one infection they help prevent is one less patient they will have to treat. I'm Jacob Lazaro and we are One News.
This just in, the IATF has now allowed the opening of indoor non-contact sports venues such as gyms, skating rinks, and racket sports courts in the NCR Plus bubble at 30% venue capacity. Task Force has also allowed the opening of historical sites and museums in the NCR Plus areas at 20% venue capacity. However, guided tours in these historical sites and museums are still prohibited. The IATF has likewise allowed the movement of fully vaccinated senior citizens in areas under general community quarantine and modified general community quarantine, subject to the presentation of a duly issued COVID-19 vaccination card and strict observance of the minimum public health standards. Quezon City has started vaccinating its essential workers under the A4 priority group. Mayor Joy Belmonte said 43,800 doses of Sinovac are available to inoculate residents under the A4 category. 6 vaccination sites are available for A4 inoculations, including the Esteban Abada Elementary School, Batasan Hills National High School, Ateneo de Manila University, and the Caligayan Activity Center. Belmonte says the LGU can open up to 50 vaccination sites, but only if they have enough supplies of doses. 3 suspected NPA rebels allegedly linked to the mine blast in Masbate have been gunned down in a recent encounter with the military. But the NPA denies that they were part of the group. Jenny Don tells us more.
This is Leline Poligrates with her father Antonio, a 61-year-old barangay tanod in Kawayan, Masbate. In a Facebook post, she said her father was kidnapped by still unidentified armed men. The following day, they were informed that Antonio died in an encounter with uniformed personnel. She was tagged as one of the members of the New People's Army behind the Sunday's bomb attack in Masbate City. The incident killed FEU football player Keith Absalon and his cousin while biking in the area. Lalin said the claim is far-fetched due to her father's physical condition.
Tapos may hawak na baril, mali pa yung pagkahawak ng baril. Kung sinabi nilang nanlaban yung tatay ko, matanda na yun, ba't di nila ginako? Tinulong, bakit binatang nila?
In a statement, the Communist Party of the Philippines condemns what they call a massacre. The CPP also clarifies that the victims were not members of their armed wing. It adds that troops fabricated the encounter to claim the reward offered by the NTF-ELCAC. But the military immediately refuted this, saying they have recovered enough evidence.
Lahat po yan ay pakana lang ng ating mga kalaban sa gobyerno, no? Yung mga communist terrorist group. They are sowing fake news.
They claim that they recovered some paraphernalia, including 16 high-powered firearms. For the armed forces, efforts to resume peace talks with the CPP-NPA will be futile.
Hindi na karapat-dapat pang pagbigyan ng pagkakataon na naman ng usapang pangkapayapaan upang i-violate lamang ang karapatang pagtao.
High-ranking officials vowed to continue hunting down rebels responsible for civilian killings. For News 5, Jenny Dongon, we are One News.
Recently, the Philippines has also approved the use of Pfizer's COVID-19 vaccine on children aged 12 to 15. But before that, the US, UK, and Canada had all authorized COVID-19 vaccinations for young people. Bloomberg's Catherine Gemmell answers frequently asked questions on QuickTip.
Hi, this is Catherine Gemmell. I'm a healthcare reporter at Bloomberg News in London. Earlier this week on our Instagram, we asked you guys to send in any questions you might have about young people and vaccines, and we received so many, so thank you so much for that. Obviously, it's really important to state that the vaccine rollout differs differs from country to country. So we've kind of brought together a more broad spectrum of questions that you guys had. Here's what you wanted to know. If young people are low risk, why do they even need a COVID-19 vaccine? Although COVID-19 symptoms are generally milder in young people can still suffer complications from this disease. Another reason why young people are being asked to get the vaccine is so that they can't transmit that virus themselves and so that they can protect the communities and their families that they're in. Which vaccines are effective in young people and when will they become available to under 18s? Just recently, Moderna released the results of its trial that found that their vaccine was effective in those ages 12 to 17. So the next step there is that they give this data to regulators in hope that these age groups can be vaccinated with the Moderna vaccine.
The US, the European Medicines Agency and UK regulators have all now approved the Pfizer vaccine for teenagers with the hope of vaccinating babies as young as 6 months old.
Are vaccines safe for children in general? So yes, vaccines are safe for use in kids and young people in general. And this is the same whether it's a COVID-19 vaccine or any other early years inoculations that might be offered to children. However, the US CDC does say that some kids require special vaccination needs, and if this is the case of your child, that you work with your doctor to ensure that those needs are being met. What are the side effects and what if kids can't cope with them? So any vaccine can cause side effects, and as we already know from those who have already had the COVID-19 vaccine, you can get some mild side effects from this. So this can range from a sore arm to feeling fatigued or just feeling a little bit unwell. But these do normally subside within a few days. Pfizer has reported that the side effects that adults experience with the COVID-19 vaccine are the exact same as those experienced by children. And the US CDC has urged parents to remember that although there are some side effects associated with COVID-19 vaccines, the risks of not being vaccinated at all are also there. Does the vaccine impact the reproductive system or lead to infertility? So we actually had quite a few of you guys ask this question, and according to the British Medical Journal, there's, quote, absolutely no evidence that the COVID-19 vaccine can impact the fertility of male or females, and this was citing an Association of Reproduction and Clinical Scientists and the British Fertility Society. The BMJ also said that it was worried about what they called blatant misinformation on this subject that was going around social media. So that's all for now, here from a very young people filled St Paul's. For more reports on the vaccines and the pandemic, follow at QuickTake.
Skateboarder Margielyn Didal has officially clinched a spot for the Tokyo Olympics next month. Didal was part of the 20 names released yesterday by the World Skates, the governing body of the sport. She is part of the group who will compete in the women's street division field in Tokyo on July 25 and 26. Didal is the 10th Filipino to be part of the country's contingent to the Summer Olympics. This will also be the first time that skateboarding will be featured in the biggest sporting event in the world. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.